Yes, my name is Dr. Mark Mosk. I'll do a little more introductory in a few moments. As you all know, the title of today's talk is Clinical Issues in Parental Alienation, focusing on reunifying with adult and minor children. So I'd like to start out today in a somewhat unusual manner by reading a small segment of the many dozens of questions that were submitted by you all in advance of today's webinar, and for a clear purpose that will become clear as we go through this. This is just a sample of the questions that you have submitted. Number one, in court-ordered therapy, we all were instructed to see different therapists, but they seem to be unfamiliar with parental alienation and even deny its existence. They have done more harm than good. Is this common? Next. Will my alienated 15-year-old daughter have the courage to let me into her life when she turns 18, or will she shut me out of her life for good? When an adult child cuts off all communication, how does a devastated, suffering single parent even connect for reunification? How do you reprogram a 21-year-old or get them to reconsider what they have been reinforced to believe? Is it realistic to try to make inroads with an alienated child, or do I just give up? If the court does not issue a 3-month no contact order with an alienating parent, what would be the best option for reunification? Can any program or professional make a difference? How can a targeted parent ever hope for reunification? What is the best thing to do to reunify with my son? Should I write a letter, text weekly, or ask his sister to talk to him on my behalf? I haven't seen or spoken to my daughter for 3 years. Is it likely that reconciliation can get worse over time? How do I cope with my teenage daughter who behaves normal and authentic when with me, but completely different when she is with her dad? What further impediment might an adult child's substance abuse present in the reunification process? I'm a targeted mom with 2 adult alienated daughters who recently reconciled with me, but now they're threatening to cut me off unless I withdraw my motion in court. What's the best approach? My 14-year-old daughter believes that 2 retaliatory and unfounded Child Protective Services claims by their father are evidence that I'm a bad parent. How and when do I stop this false narrative when we begin family therapy? Is there any success with structured family therapy for one parent or child if they get a child to attend? And what type of counselor would you recommend to do that? How do I approach an email to my adult alienated son about visiting our grandchildren this summer? I've walked on eggshells for 8 years. And finally, what's the most effective way to change people's perception? A wide variety of different thoughts, questions, issues. All of these questions scream out to all of us, not only the fact that there's a very broad scope of emotional impacts from parental alienation, but also the emotional impacts of PA, the types of impacts and the emotional impacts. What are some of those emotional impacts? Very broadly, we're going to be talking about this in more detail as we go on. Confusion comes out from these questions. Anger, resentment, hopelessness, sadness, frustration, and anxiety, of course. Now, these emotional impacts all lead to the same exact place. They affect behavior. They affect us and our ability to function. In other words, parental alienation is an exceptionally complex and still relatively poorly understood phenomenon, but to be certain, it is real, it's harmful, and it impacts the lives of many, many family members, immediate family members, extended family members, friends, acquaintances, and it does so for generations, has a long-lasting adverse negative impact. So real quickly, just to embellish a little bit on what Elaine shared with you in my introduction, I've been working now for about 35 years as both a forensic psychologist and clinical psychologist, with very deep forensic experience for the court systems, both here in California, in in California. I'm actually currently in my Chicago office. With a focus on treating very difficult and often resistant psychological disorders in clients, primarily in the form of depression and anxiety. My work in family law and parental alienation began about 15 years ago when I became interested in this phenomenon in the context of assessment. I have since spent a significant amount of my professional time in clinical care as well. Most of my work in parental alienation these days has been on advising and supporting alienated parents clinically, typically in cases of mild or low or moderate parental alienation and reunification efforts, as well as advising legal professionals on case-specific matters. Over my career, I've conducted well over 1,000 forensic assessments, including many child custody assessments. And my research interests at this time in my career lie in the area of assessment of one might be characterized as normative parenting. What is normal to expect of a parent, and in what circumstances, what cultures, etc. And this applies mainly to identifying the early warning signs of parental alienation behaviors. It is a subtle process. We will talk about that a little bit later in today's presentation. But it is at this point not well understood exactly the subtle and often obscured process that takes place as one parent begins alienating the children from the other. So today's topic is all about empowering you as the alienated parent and grandparent, and empowering you to facilitate, hopefully down the road, reunification and reconciliation with your alienated child, whether that child is a minor or an adult. Now, it's important to recognize that I will be approaching my comments today from that of both a clinician and a forensic specialist, assessment specialist. So one thing that it holds true as for me as a professional is that I'm very transparent about what we know, what we don't know about this field. One thing is for certain, and this may be hard to swallow, is that the notion of reunification may be simply something that's aspirational, something that we continue to hope for, continue to believe will eventually occur over time. And it is critical to maintain that attitude over time. It is possible that reconciliation may not come immediately according to the guideline you have in your minds. Nevertheless, that does not mean that at one point in time, you will not be able to successfully reconcile and reestablish a meaningful relationship with your child. The second element is what I characterize as an unfairness factor. All of you, by and large, have been dealing with or have previously dealt with the legal system, the court system, family court, domestic relations court. As many of you are aware, the court may not and often does not offer relief in situations where there indeed is parental alienation present. The court may not recognize that it even exists, although you know for sure, and the evidence is overwhelming that the child has been alienated. Nevertheless, the court may not recognize that to be the case for various reasons, leading us to feel very rightly and justly that the legal system is unfair. And for us to be able to understand and address and live with the fact that it is unfair can be very challenging. We may not be able to fix that issue. And then the last element is the fact that there are within every single case of alienation, I would argue, the existence of false narratives and stories that have been woven and produced by an alienating parent that paints a picture of you, targeted parents and grandparents, that are completely untrue, completely false, absolute lies. Nevertheless, the process undertaken by alienators often can be so convincing that the court and others, including agents of the court, believe that narrative to be true. creating for us, therefore, very much an uphill battle moving forward. What I'd like to do now is to talk about how we optimize the conditions for possibly reunifying with a child. And we're going to set this up into four different categories, distinct categories. And let me review them with you now. And then we're going to be going into depth on the topics presented by each of these categories. First of all, and crucially, category number one is to manage your own mental health, to prepare yourself for a potential reconciliation and growth of a relationship with your alienated child or grandchild. Now, this requires both emotional management in ourselves as well as behavior management. If we can do so, if we can manage our emotions and behaviors in an optimal way, this can enhance and improve our decision-making and our problem-solving abilities, which is crucial going forward to reestablish relationships with our loved ones. Ultimately, the ability to facilitate contact will mandate proper and effective decision-making and problem-solving, and that is only done if you are able to manage your emotions and manage your behaviors, as difficult as that is. And we're going to be talking in great depth today about how to do that. After all, I am a clinician. Secondly, we are under this topic of managing mental health. We want to be able to help you as individuals reduce some of the negative symptoms and negative feelings that you have about your circumstances, about the court situation that has been perhaps very challenging, about the frustrations you experience with the other parent, with the difficulties you have in trying to convince or facilitate contact with a child who continues to resist those efforts. And then thirdly, we want to reframe the situation. We want to learn how to recharacterize the situation that you are in a way that is not false and not untrue, but is more accurate and realistic, and one that you can find a way to live with that will allow you to live a healthy and productive and happy life, of course, while still facilitating efforts to reunite and reconcile with a child. We have to learn to be able to accept the limits of your control and influence over the situation, and this is extraordinarily difficult. The second topic under optimizing conditions for potential reunification is to be able to balance what I characterize as a dialectic or tension. What's the tension involving? It's a tension between the hopelessness that you might sometimes feel, the hopelessness, and the maintenance of hopefulness that everything will work out okay in the end. To transition from sensations of anger and despair to long-term hopefulness and eventually, hopefully, reconciliation. There are, however, no timelines of how long reconciliation might take, reunification. Nobody knows. So do understand that your journey in this process, as difficult as it is, will remain a marathon, not a sprint. Look at this as a long-term project with a long-term goal in mind, and one that has a very, very good chance of actually coming to pass. Third element in empowerment is understanding the cognitive and the behavioral change dynamics. I'm going to explain this in both yourself and in the child. Cognitive and behavior change dynamics. What is that? Cognitive refers to our thinking process. Do understand that the way you see the world, the way your child sees the world, is reflective of a particular position. Certain views have come into place for both yourself about your situation and the lack of contact with your loved one, and likewise for the alienated child, be he or her a minor or an adult. That child has very particular views, perspectives, attitudes, and understandings of the situation in which they find themselves and in their relationship with you. The more and better you understand how that thinking process works in your child and in yourself, you'll be better able to both manage yourself and facilitate reunification down the road. And then finally, how do we facilitate the reunification process? Reunification therapy. And I will be discussing a little bit later some guidelines I would recommend for specifically court-ordered reconciliation therapy. But we're going to talk as well about more informal, non-court-ordered reunification therapy as well. And the term therapy, as you'll see down the road, may not be in any way, shape, or form the proper term to be used in this context. So next, how do we maximize the possibility of reunifying with a loved one from a psychological standpoint? First, there is clearly a perception and belief that you hold no doubt that you lack control over the situation that you face. And it is this element of lack of control that I believe is so disheartening and so harmful and so destructive in families. And it is a perception that, while will always remain true, there's only a limited element of control. It doesn't mean that there is a total lack of control. In other words, there are things that we can do, areas that we do have control over to facilitate a reunification with a child. But to a large degree, we are unable to have a direct and strong influence over an alienated child as individuals. It is also nearly impossible, as many of you I'm sure will attest to, that your ability to influence and have any control over the alienating parent is, well, that speaks for itself. To what degree do you have influence over the legal system? Limited control, but not no control. For example, for those of you who might still be involved in the legal system, whether you are represented by an attorney or if you are representing yourself pro se, you do have a voice in the courtroom. There is the opportunity, if it is a matter that is still in litigation, to influence other agents of the court, such as GALs and the like. It is this sense of a lack of control, I would argue, is one of the primary causes of alienated parents' feelings of depression and anxiety. As Elaine mentioned, I have been working as a clinician now for well over 30 years. And my work with alienated parents began in about 2007, 2006 or so, at which time I became acquainted with and began encountering adults suffering from depression and anxiety, and unbeknownst to me, learned to recognize over time that many of those individuals actually were involved in situations, some directly with the court, some who had previous interactions with the court, that were presenting as highly depressed or highly anxious. And the root cause of those symptoms was indeed the fact that they were alienated as parents. And that is ultimately what prompted me as a professional to become more inquisitive and more interested in this area, at which time it was not extraordinarily well understood, and relatively little true academic and empirical research had been conducted. And that began my journey into this area. So you can't control the courts, you cannot control the attorneys, you cannot control the alienating parent or the alienating child, but you can control yourself, you can control your beliefs, your attitudes, and your actions. And we're going to be talking a lot about that today. As a clinician, my role is to enable an alienated parent to overcome the sometimes devastating emotions that they're experiencing, again, primarily feelings of sadness and lack of control, and nervousness, and enable them to better be able to recognize their emotions, reframe those feelings in a more productive and a helpful way so they can continue living their lives, instill longstanding hopefulness that relationships can be established, and then provide for them tools to help that move further ahead. One of the analogies that I use with many clients is what I refer to as the airplane analogy. There's this idea that one, of course, would like to reach out and just grab and hug an alienated child and bring them back into your loving arms. It is the case, however, that is a long and a steep hill to climb immediately. You may not be in an emotional place to be able to do that effectively, to be able to, if given the opportunity, to reunite right away. There's perhaps still feelings of resentment and distrust and anger and melancholy about the whole situation. So the airplane analogy goes like this. You will all of you, I'm sure, have been on airplanes in which at which time at the beginning of the flight, the flight attendant comes around and provides the instructions mandated to the aircraft by the FAA to put on your mask, you will recall, in the event of a loss of cabin pressure. And the instruction goes, you must put on your own mask first before helping others. Why is that? Well, of course, without oxygen, you will eventually pass out and you won't be able to help anybody, yourself or the people around you. The same holds true for situations of alienation. It is crucial to put on your own mask first to get healthy, stable, functional, and capable. And then you can help others. You can help your child more effectively that way. If you're unable to help yourself, you can't help others. And that is the purpose of therapy in the context of enhancing the lives of alienated parents. What else can you do? You also can document ongoing episodes of alienating behavior by an alienating parent for the court. Now, each of you is at a different place in your journey, and your access to the court system may be different from one to another, but one can continue to observe, recognize, and capture ongoing episodes, ongoing alienating behaviors to bring it to the attention of the court, should there be an opportunity to attain some form of remedy by the court. What can you capture? You can capture relatively simple things, such as a child's refusal to visit. You can as well capture evidence of alienating behaviors, and I'll be talking about this down the road as we go on today, that are categorized by Amy Baker's work, Dr. Amy Baker's work, under her 17 different alienating behaviors, such as children referring to their parents by their first names, such as an alienated parent's removal as a contact source in a child's school, et cetera, et cetera. You can continue to document that systematically and keep that information should there be an opportunity down the road to address the court once again to seek some form of remedy. Now, mind you, the goal of this entire process is to be both emotionally and functionally prepared to facilitate a possible reconnection and a reunification with your alienated child or grandchild. One question that often has arisen is whether or not there's a difference in how we can facilitate reconciliation if the child happens to be a minor or an adult. There is no clear answer, but let me just add a couple of remarks about this. Number one, of course, the minor is still under the influence of the alienating parent by and large. if they haven't attained age of majority yet. They are under the influence of that parent, but they are also under the influence of the court. So if the court is a compassionate and knowledgeable and aware court, there is the possibility that despite the ongoing influence of the alienating parent, the court might have the opportunity and capacity to intervene. Now, on the good side, good news, so to speak, is all relative. A minor child has had less time than an adult child living with the cognitive distortions, that the false narratives and thinking process that has been instilled by the alienating parent. The minor has lived with that for a shorter period of time than the adult, of course, less time has passed. However, they may be more susceptible to the cognitive and the emotional influences, the narratives, the false narratives being exhibited by the alienating parent. So the good news is that the child has had less time being negatively influenced. The bad news is that they remain susceptible and very well might be solely in the custody of or in the presence of, let's say, with the alienating adult. So there's a shorter behavioral history of resistance to visiting with an alienated parent and a refusal to even consider doing so. And thus, this is where we must intervene, and to do so as early as possible. When the children are as young as possible, when we identify the presence of alienation taking place and recognize that that alienation is in fact alienation, it is true, it is the beginning of a process that should send up a red flag to all the parties involved, and then intervention ideally should take place at that point in time to stop it from developing any further, to intervene as early as possible. The challenge, however, is that we don't yet have a clear understanding of what those early alienating behaviors might all be like. We miss them. And we're going to be talking once again about this in just a little bit. Another question that sometimes comes up. As you are aware, many of you are aware, that we often delineate the severity of parental alienation in different categories. We sometimes refer to alienation as being mild or moderate or severe. And different authors have varying definitions, I should say, about what constitutes mild, moderate, and severe. We don't really know exactly when and how an alienating behavior, a pattern might develop that goes from mild, sometimes very quickly, to a severe level. We have a poor understanding of the mechanisms involved. And more importantly, under the question of whether or not there is a correlation between how much emotional reactivity a child has. So in other words, how much a child might have come to fear and want to avoid a parent, a targeted parent. We don't have an understanding of whether or not, for example, mild alienation leads to only minor and mild symptoms in a child, minor influence, or is the same true for the targeted parent? Whether or not parental alienation might only be just very mild, it doesn't mean mild alienation automatically results in mild despair on your part. Any alienation could most certainly have a very significant negative impact on alienated parents, on you. Likewise, if moderate alienation is taking place, the definition of moderate is taking place, it doesn't mean that one's emotional reaction as the targeted parent is going to be moderate or mild or severe. We simply don't know. There is no correlation. As I approach my work with alienated parents, I look at any level of alienation as significant and in need of immediate redress and address to fix the problem as quickly as possible so that it does not evolve from perhaps an individual experiencing mild symptoms and mild sadness and mild despair to something more severe. We're going to talk about that in just 1 minute here. So the question is, are there any unique emotional impacts from parental alienation as opposed to other sources? In other words, through the process of alienation, are you experiencing emotional symptoms that are unique and in a category of their own relative to other sources and reasons for people being anxious and depressed? And the answer really is, we don't have the data. We don't know. We simply don't know. At this point, by and large, as clinicians who work with the alienated parents, find ourselves basically addressing, I don't want to call this run-of-the-mill depression and anxiety, but we have no way of really differentiating the nature of the depression or anxiety as being different from other sources. But that being said, it is crucial and paramount that the treating doctor, that the psychologist, that the therapist, that the social worker, that the clinician is extraordinarily familiar with the process of alienation, the field, the research. And the research every single month is growing and growing and growing. Again, while there's no clear evidence that the type of depression that one might be feeling is different than other types of depression, in order to treat it properly, it is absolutely necessary and requisite that the clinician be an expert in this area. So what are the ways that one can seek for help if it's not going to be directly from a therapist? Simply general social support, friends, family, acquaintances. Who might be the best possible individual in your life? Somebody that you trust, somebody that you can count on to simply share. And again, this might be another family member. This could be a family member that is a direct target as well of the alienation, or a family member that is aware of it and is not directly being affected, but somebody who understands you, who believes in you, who trusts you, who feels compassion for you, etc. Who else? Sometimes simply friends and acquaintances, people that you trust, people at work, neighbors that you have a long-standing relationship with, people in whom you can confide with honesty, with sincerity, and know that you will be able to get true compassion, true understanding, and the absence of judgmentalism. In other words, the notion that that individual is then going to perhaps suspect that you are the reason for the avoidance, for the resistance of the child to come spend time. Again, we're going to talk about this as well as we go forward. There are community resources at times simply that those that are not necessarily alienation oriented, but individuals who are simply experiencing a sense of loss. I've had a number of patients who, interestingly enough, have sought the support of grief counseling, which is mainly for individuals who have passed away in their lives. But some of the commonalities of learning to accept the idea that this terrible and unexpected separation from a loved one has taken place, they have found some comfort there. Not necessarily something I directly recommend, but I have found it interesting that there are some commonalities across the types of support offered by that group and in its application to alienated family members. And then again, there are formal support groups. And And I couldn't be more proud of the work that Family Access and Elaine and her colleagues, both lay and professional, have been providing and organizing and disseminating now worldwide. It is an extraordinary achievement, and the support offered by Family Access enables individuals to do exactly what is necessary to learn, to engage, to become educated, and to know that you are not alone in this journey. Sadly enough, you're not alone. On one end, simply the fact that there are so many tens of thousands, perhaps more individuals around the world who are suffering the throes of alienation, but the fact that they are able to engage with other people with whom they can identify, they can share feelings and stories, and derive comfort from that process. And then finally, there is professional treatment. Most of my work as a professional within the area of alienation involves working with individuals who are suffering dramatically from the loss. And they typically approach me at a point in time in their lives where the anxiety levels are very severe and the sense of depression and hopelessness likewise are very severe. And that's when my work with them starts. So as we move forward in today's talk, I'm going to be sharing with you part of the process that's involved in treatment, the therapeutic process that I provide for alienated parents. Of course, we're not doing therapy here today, but the goal is to educate you and make you aware of the crucial elements of effective professional support and therapeutic intervention, so that you can recognize perhaps if it is present in a clinician with whom you are working, and perhaps more importantly, to know what to seek out if you eventually choose to seek professional intervention. Self-help is another area before we start on a discourse of the professional intervention. What is self-help? Self-help is simply helping yourself without the resources of either a professional or even general social support. Now, mind you, I would encourage every one of you listening now to seek some form of social support and to join a group. And of course, you already are part of Family Access. Social support is crucial in being able to cope effectively with the very real difficulties and sometimes very long-term challenges of being separated and alienated from a child. Self-help most commonly takes the form of various types of books and other reading resources. I'm not going to make any recommendations per se now, but I am certainly aware that those resources have been both advertised and made available through Family Access, and I would encourage you to reach out and learn about some of the books and other both professional and lay titles that can be helpful in understanding where you are and how to feel better. Another element that we often encourage patients to engage in, another therapeutic approach, is what is referred to as journaling. Journaling simply involves taking the time to set aside a private moment or moments. Sometimes people do this right before bed, but it doesn't really matter when, to simply write down your feelings, like the old days of writing in a diary. But the purpose of this diary is not to document the events of the day and how you were feeling broadly, generally, but instead to focus that effort on how you're feeling, how you're coping with the various issues presented by your role as an alienated parent, what you're doing to cope, what you are doing to feel better, what you're doing to help others who are alienated feel better. Journaling, for some reason, and I could spend the time, and I'm not going to do this, to describe some of the theoretical foundations of journaling, but it's simply the idea of being able to take your thoughts, listen to your feelings in quiet moments during the day, and simply write them down, acknowledge them, and then put them away for a short while. So along with the concept of journaling, I often will recommend that people adopt what I refer to as a cubbyhole approach. What is that? Many of you may remember during elementary school, during grammar school, that when you went to school as a little 5-year-old, 6-year-old, you walk into the classroom and the first thing that you would see to the side was an area where you could hang up your jacket, your coat, your sweater, a place to put your shoes if you're in a climate that requires wearing boots during the winter, to put your boots, to put your lunch box, your sack lunch, and a hat and other paraphernalia, and to take all that and stuff it into a little box that was open from the front, a cubby hole, and place it in there. The value of a cubby hole is that you can see what you have in your cubby hole, but you don't have to take it out. It's there if you need it, but it is not necessary and critical to have it with you all the time. Same thing is true with your thoughts and the journaling exercise. Your ability to write down your thoughts, think about them, contemplate, cogitate, analyze, come to some temporary conclusion or not, to write down those thoughts and then put them into your virtual cubbyhole inside your head, a special place that you know that these thoughts, these feelings, positive and perhaps negative, those very challenging emotions, to acknowledge them, to recognize what they are, and then put them away temporarily into the cubbyhole. And when you're ready, and you designate the time that you are ready, then and only then do you pull them out of the cubbyhole, sort through them, see what's there, review them, and then add more to it. Analyze, massage them, get a feeling for what's there, and advance how you feel so you can continue to cope effectively with the challenge that you face. Now, we are going to go on to where I spend most of my time, and that is in the more difficult clinical area of addressing alienation. So, tell me if any of the following words, the following feelings and emotions strikes you as familiar. I'm going to read a number of them for you. Despondent, empty, hopeless, dejected, broken, damaged, impotent, powerless, useless, worthless, desperate, horrified, panicky, intimidated, shocked, trapped, stunned, shocked, flustered, confused, chaotic, baffled, abused, destroyed, devastated, disgraced, humiliated, punished, rejected, ruined, provoked, outraged, furious, bitter, abandoned, cut off, forsaken, isolated, ostracized, outcast, rejected, wronged, shamed, judged, humiliated, disgraced. Do any of these sound familiar? Of course they do. And it is with these types of feelings and emotions that we clinicians are approached for answers. The answer isn't an easy one, but we do have methods as clinicians, procedures, approaches that, together with a deep understanding of parental alienation, its processes, the mechanisms, their histories, and the research that we know is informing us much better than in the past of how to help individuals going through the process and the phenomenon of alienation. We do have a way forward, an effective way forward. There is a concept that is known as learned helplessness. Learned helplessness was based upon some very interesting research conducted back in the 1970s. And it initially with little puppies, of all things, they taught puppies how to become helpless. And that area of research then got translated to the question of how do we help people, individuals, human beings, us, to manage helplessness, and what are the processes involved? How does one learn to become helpless? It involves the following. When we as individuals are presented with choices that never seem to produce a positive result, such that no matter what we do, every effort that we take, every action step, every attempt to resolve, every goodwill action, everything that we do to provide information for attorneys, for the court, for the judges, for children, no matter what it is that we do, regardless of how sincere, how effective we are, it results in the same conclusion: nothing. We don't get what it is that we're looking for. We never achieve the goal. Hence, all those efforts result in the absence of accomplishment, helplessness. And is that sense of helplessness and is what ends up being something that we learn, hence learned helplessness. A good number of alienated parents, yourselves, have learned helplessness, unfortunately, that despite every good effort on your part, we have reached a point, you have reached a point where no matter what it is that you do or try over and over and over again, sometimes you have the same conclusion. Nobody's listening, nobody's believing, and one feels truly impotent. And it is that helplessness that we as clinicians first have to begin addressing. And we're going to talk about that today. The three most common forms of symptoms, of emotions that we see in a clinical setting are anger and anxiety and depression. Now, interestingly enough, this may come as a surprise to you, but by and large, there isn't such a thing as an anger diagnosis in the mental health field. There is, however, anxiety as an area of diagnosis, and depression, of course. I share with all of my patients to help them understand the nature of the resentment and frustration that they feel, which largely are synonyms for anger. That feeling is basically an expression of their acute anxiety. The idea that one is uncertain about what the future might bring, there is a lack of predictability about the future. One doesn't know what to anticipate about the future. And therefore, that lack of awareness, that lack of clarity brings about anxiety. And people can manage their anxiety in one of two ways. There are those of us who manage our anxiety by keeping it inside and not letting anybody know, but we know inside our stomachs churn. Some of us develop ulcers, others develop other medical problems, cardiovascular disease, etc., by holding in all that stress, all that anxiety. Others, however, don't hold it in. They express it outwardly. They externalize it as opposed to internalize it. And the way people externalize all that anxiety, all that frustration, all that stress, they don't know what to do with it, so it gets expelled. And sometimes very spontaneously, sometimes in the presence of others, sometimes not. But that is what then is termed anger or frustration or resentment. So we find ourselves dealing with anxiety and depression. So what must we do as a community in working with alienated populations, alienated parents and grandparents? What must we learn? We must learn patience, a key factor. We're going to talk about this again as we proceed. Patience, and I would add to that in parentheses, immense patience. We must learn anger management skills. We must always avoid being dysfunctional, unable to function in our role as adults, as both, and certainly that includes being effective and parents that and grandparents that are able to continue fighting the good fight. We must be able to address our own anger feelings and catch those feelings before they actually show up and are exhibited outwardly as anger. We want to learn to be able to manage the anxiety, of course, and the depression. We want to instill hopefulness. And this goes back to this notion of having a dichotomy that I mentioned a little bit earlier, a dialectic. The tension between the fact that you feel at times very hopeless, and yet at the same time, you recognize that you have to still be hopeful. How do you balance those? How can you be hopeless and hopeful at the same time? And there's a skill to that. You must as well learn the dynamics of resistance. What does that mean? The question is, why suddenly does your loving child, who previously had a very close and meaningful and deep connection with you as an adult, as a parent or as a grandparent, why suddenly are they resisting and avoiding that relationship? And there are reasons that that happens. Of course, it has nothing to do with you, but it has everything to do with the alienating parent. But there is a process that the child undergoes early on during the alienating process in the methods used by the alienating parent. There are gradual shifts in the child's views and beliefs about you as the parent or the grandparent. And over time, the child's perspectives and belief system becomes dramatically altered. The things they come to believe are radically different than their original truthful beliefs. And consequently, their views and attitudes and perceptions of you has become altered. And based upon those views, their behavior changes as well. Rather than experiencing necessarily love and admiration and connectedness, instead there may be a sense of fear and uncertainty about you. And those emotions then lead to resisting behavior, avoidance by the child. In other words, the sequence goes: a change in the belief system of the child produces a change in their feelings, and hence that produces a change in their behavior. Understanding the way this works is extremely helpful to coping with alienation. And then the last element is the cognitive bias, as I mentioned before. The child comes under the control of the alienating parent, is influenced in terms of their very vast belief system. And the child now has developed a bias, a prejudice, unfounded about you as a person, who you are, what they should mean in your life, and the degree to which they should feel comfortable in connecting with you. The most common technique and approach to helping alienated parents address the stress, address the anxiety and depression associated with your situation is what is referred to as cognitive behavior therapy, or CBT. Many of you have heard of this term before. Perhaps some of you also have participated in CBT treatment. There are clinicians, of course, who do it far better than others, and on the converse, many clinicians who do it very poorly. But nevertheless, cognitive behavior therapy is a method that allows us to systematically identify the negative belief system that one has, the false beliefs that one has, and then gradually helping one to shift and transition those beliefs from the false narrative to the true narrative, to shift from believing that you might not be a safe person when in their company to the truth of the matter, which is you absolutely are, and you are a key and loving resource in their life now and in the future. CBT has been around now as a therapy model and approach, and a clinical protocol, a step-by-step set of procedures for well over 40 years. And it is empirically driven. What that means is that there are literally thousands of research articles that support its effectiveness. And it is a way of helping an alienated parent identify how they are seeing their world, how they see themselves as the alienated parent, how they come to perceive and interpret the situation in which they find themselves, at a loss of being able to connect and not understanding why. The whole issue of lack of control that I mentioned early during today's talk, how to be able to understand what they are thinking, understand whether or not what they are thinking is actually true or partially true, or perhaps distorted based upon the suffering that they have been experiencing, and then consequently help those individuals reframe, re-understand, reconceptualize how they are seeing their circumstance. And that process over time allows one to gradually erode the negative emotions, the anger, the despair, the frustration, the sense of rejection and humiliation, and the fear and the sense of powerlessness over time, and erode that so that one can feel much more optimistic and healthy and realistic and capable over time in continuing to facilitate a reconciliation. Another term that's often used in this process is what's referred to as controlling or self-managing self-talk. We all talk to ourselves. We all speak to ourselves. We all are constantly 24 hours a day, 7 days a week in a dialogue with ourselves inside our brains. That dialogue is unregulated, meaning that it is taking place automatically and in your subconscious. You're not aware of it. That self-talk is the source for the frustration and anger and despair. The things we say to ourselves determine how we feel and how we behave. If we are able to understand and to recognize the nature of what we are saying to ourselves, of our beliefs, of our views of the world, of our potential future, it is through this process that we instill hope. So by changing the nature of the self-talk and the way that we actually program ourselves like a computer to believe one thing or another, if we can control and manage what we say to ourselves and ensure that that is realistic, it's accurate, it is true, it puts us in a power position to be able to have control over our emotions. It doesn't mean we are going to blank out our feelings of sadness. Those are completely legitimate and warranted, of course, but we don't want those symptoms to be overwhelming, those feelings to be to control you. You want to be able to control your emotions. There are different ways that we tend to fool ourselves, that our brains tend to fool us to believing that something is true and something is not true. These are what are referred to in the field as cognitive distortions, a distorted or untrue, a false way of holding on to a belief. Cognitive distortions are the ways that our mind convinces us of one thing when in reality it's completely untrue. So these inaccurate thoughts are usually used to reinforce a negative thinking pattern. We're telling ourselves things that sound rational, they sound truthful at that moment, but in reality, they only serve to trigger feelings of negativity and pessimism. So you can overcome these thinking traps by learning to notice and identify when you're using a negative thought, when you're having a negative thought, and when you're using a cognitive distortion, and acknowledging that you are having a negative thinking pattern, and then challenging and refuting that thought that you might have, and reworking it, reframing it into something that is more accurate and truer and more positive. So I want to spend a few minutes here going through some of the types of common cognitive distortions. There's what is referred to as all or none thinking. What does that mean? That means you look at things in absolutes, black and white categories. In other words, my child is not with me now, he never will be. Overgeneralizing is when we view a negative event as a never-ending pattern of defeat. My grandson doesn't come to visit. I don't think he'll ever come to visit. None of the children will want to see me again. There's what's referred to as discounting the positives, insisting that everything that you have accomplished or all of your positive qualities don't count. For example, I have reached out to my child so many times that it hasn't made a difference, and therefore everything that I've done was useless. It was not effective. Mental filtering involves dwelling on the negatives and ignoring the positives, filtering out all the positive things that might still be a part of your life. Jumping to conclusions is when you conclude that things are bad, but there's not sufficient evidence to support your idea that things are really bad. In other words, this is like mind reading or fortune telling. We believe that things are going to happen in the future with no evidence to support it, and we jump to conclusions. Now, of course, I'm sure all of you recognize that these are things that we all do in our daily lives. It has nothing to do necessarily with alienation per se, but these are what we call cognitive mechanisms, the way the brain works in all areas of our lives. And then finally, because we're going to be talking about this in a moment, there are what are referred to as should statements. You criticize yourself and sometimes criticize perhaps other people, but mainly yourselves, with shoulds. I should have done this. I ought to have known. I must have done something wrong. I shouldn't have done what I did. Should statements are also cognitive distortions because they rely on the idea that you have a pre-existing knowledge of the future. So based upon what you should have known, you would have done differently. The truth of the matter is, though, you didn't know, and you did the very best you could based upon the information you had and what was available to you at the time. What we do through this process is that we teach individuals how to reframe the situation that you're in. It is the case that so oftentimes it feels like if you are alienated from a child or grandchild, it will never change. Despite the hope, despite the action efforts, despite the prayers, despite the monies spent through the legal system, that it will never change. But that is a form of mind reading. You don't know that it's not going to change, that reconciliation might be just around the corner. So we teach patients how to reframe the situation, put it into a healthier and more viable and productive context so that you begin to see the world in which you live and the lack of immediate contact and relationship with a child as something that is merely temporary. Merely temporary. And the truth of the matter is that it is temporary. It is temporary. We teach clients how to reset their expectations as well. When alienation takes place and individuals sometimes finally realize what has occurred and why it is that their child or grandchild is beginning to avoid contact with them, there is a sense that, okay, let me fix this real quickly. It'll be over and we'll be back to the way things were. Expectations of the timeline of how long it will take to eventually reunite. Expectations of what might be required to facilitate ongoing contact or contact in the future. Expectations of how you might feel and handle things once you can finally have an initial conversation with an alienated child. Those expectations may or may not be realistic. And our task as clinicians and your job as an alienated parent or grandparent is to set realistic expectations. Next, we want to focus on long-term goals of simply connecting. There is no doubt that all of you have in your minds a vision, an image of what the relationship might, can, perhaps should look like once you are reunited and reconciled with your child. That exact image and bringing that vision into reality may take a long time. We don't know. So again, patience is critical. We want to focus on the long-term goal and the initial goal of simply reconnecting, to having that contact. The nature of the relationship that evolves from that time going forward is up to each and every individual. It is unique to every family. How it evolves, how the child begins to reconnect with you emotionally, the dialogue that you have, the things you discuss, the things you don't discuss, the history of what happened prior to the reunification. Those are all processes that are different for each and every family. So rather than focusing on and trying to envision that particular picture, we instead want to focus more on simply creating the connection, that contact, that communication, the phone call, even the email, the face-to-face contact, of course, preferably, is what we are after. To set that as the initial goal in a long-term process allows one to be much more realistic about the timeline, and then to simply focus on achieving that goal as opposed to achieving a perhaps more distant goal of a meaningful Thanksgiving with the child celebrating at your table. Through this process, for the alienated parent, we teach a process of what is called shaping. The notion of shaping is basically taking baby steps and facilitating making contact and gradually approaching an alienated child. Again, there may be a vision of a final outcome of the child sitting with you at Thanksgiving or another holiday, but it takes baby steps to get there. It takes baby steps in order to reach out and make those first contacts. And those contacts may be nothing more than getting a response to a text, an email, a card, a handwritten note, a picture drawn with crayons, whatever the case might be. Attainment of that kind of a result is a huge win because it represents a first step in a multi-step process of refreshing and recreating and perhaps re-envisioning the nature of a relationship with the child. It's okay to think in baby steps. We all learned to walk with baby steps. Whereas there may be a desire to run in this process, it is best to take the baby steps and to ensure we don't fall down and scrape ourselves in the process. So it is a gradual process. It takes time. And that's where the need for ongoing patience is required. And it is why that we focus so much on the emotional management piece for the alienated parent, to make sure that once this element is in place, that contact has been made, that one's emotions don't get in the way of facilitating greater and greater rapprochement, greater and greater connectedness, so that the relationship can be massaged and improved and grown over time. So it's a long-term process. Along the way, prepare yourself for many disappointments and setbacks. It's not going to be a smooth ride, but human behavior and relationships never are. They never are. Think back at the time of take your closest, most loving relationship, and you'll think back that there were episodes that things were really challenging, whether it was with your spouse or with a child or with your closest friends. Life and relationships between people are fraught with disappointments and setbacks, but perseverance, meaning persistency and consistency moving forward, can overcome those disappointments and setbacks. But be ready. We want to also acknowledge that the experience that you have had is very much and was very much traumatic. It is an emotional trauma to be deprived of a relationship that is so critical, key, fundamental to your life as a human being. Highly traumatic. Therefore, your feelings are valid and warranted, and they always will be. Nobody can and should ever discount how you are feeling about your circumstances. What you are experiencing, as strange as some of the feelings might be, and as unusual and unexpected a life you find yourself in, do understand this. You are not abnormal by any means. You are reacting normally to an abnormal situation. You're reacting normally to an abnormal situation. You want to acknowledge the truth of your emotions, but you do not want to let them consume you. You do not want to let them in any way impair you as an adult, as a functioning member of society. One of the most common challenges that I've heard in alienated parents is a sense of guilt that people feel that they should have been able to recognize that the child or grandchild was becoming alienated, and at that point in time, done something about it so that the situation did not evolve into a circumstance that was far more complicated and far more hardened. In my work with clients, I designate 3 different stages of parental alienation. And this is an area that I know a number of colleagues are working on conceptually, and an area that I'm going to be writing about shortly. The guilt associated with it from the sense that you could have done something differently. So different stages. There's an early stage of alienation. I refer to it as an early stage. This is at the time when very nuanced and subtle behaviors often take place by the alienating parent and show up in the child. Things such as the child failing to show up for a scheduled time with you. Now, it does happen sometimes that kids get sick, that school homework assignments and school activities get in the way, etc. And so we are used to the ideas sometimes that children might miss showing up for an appointment. If it happens over and over and over, it's only once we have identified a pattern that we realize now this is not subtle, this is not nuanced, this is actually a pattern. And this leads us to the middle stage of alienation, where some of these alienation behaviors are taking place. We have recognized them. I would refer you to a couple of resources. I mentioned before Dr. Amy Baker's work, which has been very well disseminated and easily accessible to recognize the types of alienating behaviors that are very common. There's also the brilliant work as well that was recently published by doctors Mandy Mathewson and Jen Harmon, and they have delineated a list of different kinds of alienating behaviors as well, in a different format and a different conceptual model. For example, the presence of using children as pawns and minimizing or blaming or being blamed by children. The fact that parents are emotionally abusing the children by their actions. So I mean, of course, the alienating parents. Alienating parents using coercion, threats and intimidation, et cetera, et cetera. So that is a piece of work that is most definitely a resource that you should take advantage of and learn more about. So these behaviors have begun in the middle stage, and even if they are recognized as an existing pattern of behavior, it often is the case that legal professionals don't recognize it, that the court system, the judges don't recognize it, but sure is certain that process is taking place, and basically nobody is listening. It's like the old analogy as a kid of the little boy with his fingers in the dam, in the dike, where the dam is about to burst, and he's doing his best to plug up the holes, yelling out, "Help, help," but nobody is listening. And then finally, the later stage, in which true refusal and resistance, true alienated behaviors by the child have become established, and the relationship is, or the lack of relationship has become clearly apparent. So many parents feel so terribly guilty that they fail to recognize what they now see as obvious warning signs that alienation was taking place. At the time, because these signs, because these actions were subtle and infrequent and perhaps mild, they were missed. Think of them as what are called microaggressions, aggressive behavior by the alienating parent, but microscopic, very small, and many of them over time easily missed. And why do we miss them? We miss them because of our brains. Our brains have a tendency to dismiss or to filter out stuff that's happening in our lives, information going on in our lives, actions, events that don't seem to be relevant, and we filter them out. Otherwise, we would be paying attention to every single element and everything we experience or observe every single moment of our waking lives. There are millions of pieces of data that that our brain would be required to process, and it doesn't. It just takes in what is most obvious and relevant to the situation. And therefore, those alienating activities often are missed. They don't appear to be meaningful at the time, and therefore we don't see them. In hindsight, they seem absolutely obvious and clear-cut 100%, as sure as the day is long. But then, over time, we find that they were there, they always were there, and we beat ourselves up because we missed them. Understand this, it is not your fault. It is not your fault. It is the nature of how we are as human beings. And think of it this way as well. In my role as a forensic specialist in performing child custody evaluations and in other forms of forensic assessments, we find that even us as skilled and experienced evaluators, and mind you, I have done over the course of my career over 1,500 evaluations, not all of them in custody and family law, but even over the course of that many trials, I have indeed missed signs. And I'm pretty good at this. I have missed signs. So the fact that you miss signs is something that you should forgive yourself for. Forgive yourself because you are the alienated adult. You and the child are the victims. You are not the perpetrators. You're not the perpetrators. The process of learning to manage alienation requires what is coined, and this is really in the context, has come from the context of more formalized reunification programs, is to pursue a process of what's called psychoeducation as opposed to psychotherapy. And we're going to wind up today talking a lot about the factors that one can and should look for in more formal reunification efforts. Again, I'll use the term reunification therapy, and we'll talk about that momentarily. Psychoeducation, becoming familiar with the area of parental alienation, become aware of the trends in the field, and managing your emotional status. That is the combination of psychoeducational. The psychology behind it, the psychotherapy behind it, to enable you to become the very best you can as you fight your way forward towards reconciliation and reunification. And then deep education about the nature of alienation, what you are experiencing, to be able to put it into a healthy context and stay aware, and ideally to serve as an advocate for others in the field. When you look very broadly at what Family Access has been able to accomplish by a group of alienated parents and grandparents, to take the experience and turn it into an extraordinary worldwide psychoeducational experience is truly remarkable. That is a ship definitely worth jumping on. Now, one of the greatest challenges that alienated parents often feel, is that a false narrative has been created by the alienating parent that, unfortunately, many times becomes adopted by the very people you hope will remain neutral and professional and objective, the court system. The false narratives sometimes can be so convincing, and not necessarily solely by the alienating parent, but by their legal representative. That individual might be able to simply tell a story better, or the fact that those listening to the story are uninformed about alienation. And consequently, this fictional story about the truth of the relationship between the two parents and the children becomes adopted by others. And then unfortunately, the battle becomes very much even more of an uphill one, because it's not only you feeling you have to fight the false narrative, but also address the fact that others who are supposed to be advocates and neutral and professional have similarly bought into the lie. In this process, there is the role of what's called confirmatory bias. I know that Dr. Miller has spoken substantially about this, and many of you, I'm sure, have heard his outstanding lectures and insights. Confirmatory bias is the notion of what is sometimes referred to as cherry picking, the idea that we allow into our own narratives only that information that is already in agreement with what we believe. In other words, our brains don't allow in any type of conflicting or contradictory information to our already set foundation of belief. It doesn't allow it in. And consequently, the false narrative becomes solidified because there is additional evidence that supports the false narrative, and there is a disallowing of information that contradicts that narrative. So these biases can be perpetrated by a lot of different parties. It can be done by the alienating parent, of course, that they perpetrate the bias, by attorneys, I mentioned before, by court agents such as GALs and court and child representatives, by parenting coordinators, by siblings, for that matter, and by third parties. Sometimes, often during the course of custody evaluations, it is the case that we try to bring in some collateral information sources outside of just family members. And those third parties, neighbors, friends, and relatives and others, community members, might also similarly perpetrate a false narrative. And our job, to a very large degree, is to combat that false narrative. The only thing that can be done sometimes is to be able to try to convince the court, if nothing else, to mandate some form of reunification, so another trained professional can be brought in to more objectively analyze and inform the court. As we go forward, I want to share with you a couple of thoughts about how to reunify informally. Then we'll talk about more formal. First of all, as we approach reunification, it is important to understand that the child and yourself have undergone significant cognitive and behavioral changes, as we talked about earlier. The way you think about your circumstances, the way the child thinks about his or her circumstances, and the patterns that they have developed, specifically the child in resisting and avoiding interaction, is the result of a forced false thinking process, of course, forced by the alienating adult. So the child's beliefs end up shaping his or her new attitudes, which shape and produce and elicit different kinds of feelings and emotions about you and about themselves and about their family. And those false beliefs then affect their behaviors. How do we reach out to prompt a reunification? Nowadays, we have text messaging, we have phone calls, we have cards, we have emails, we have letters, we have digital reach out, such as, actually I'm blanking on the name of the company that sends digital greeting cards, or to do so in person. Now, many of you are, or already have, thought about the idea of addressing your own psychological, emotional needs and finding a professional therapist to work with. A personal therapist, somebody that is at a PhD level, a PsyD level, in other words, a doctoral level trained psychologist, perhaps a psychiatrist, another type of therapist, or a social worker, etc. What you want to do as a base recommendation is to ensure that your therapist and those that you interview are ones that have deep experience and knowledge about parental alienation. And I would strongly encourage you to interview them. Now, you're not going to be a very effective interviewer if you are not knowledgeable yourself. Hence, going back to the remark I made of a few minutes ago about the need to become very familiar, intimately familiar with this field, the dynamics of alienation, challenges, etc. So first and foremost, you're looking for somebody with very deep experience and expertise in parental alienation. And then secondarily, and this is going to come up as when we talk about in a moment, more formal reunification efforts, I would recommend trying to find a clinician who also has substantial experience at conducting child custody evaluations. Why? A child custody evaluator is a forensically trained clinician. This is an individual who is taught to seek out and investigate and look for those very subtle elements of alienation, those subtle elements of abuse that you and the child have experienced at the hands of the alienating parent. An individual who approaches therapy not just with clinical compassion, but also with a sense of a clear sense of purpose in fathoming out your experience as an alienated adult. Any behavior towards you by an alienated child that strikes you as being unacceptable is a topic that I want to address for one quick moment. I have seen on many occasions that an alienated parent who finds him or herself, or grandparent, who finds him or herself in a situation where there's the beginning of rapprochement, of connectedness with an alienated child, has sometimes experienced bad behavior on the part of the child, abusive behavior, blameful behavior, continuing alienating behavior directed towards you, the targeted parent and grandparent. I have seen firsthand alienated kids who agreed to reunify and connect, do nothing but blame and yell and try to manipulate you as the alienated victim. Now, mind you, the child, to a large degree, has been manipulated, him or herself, into believing certain things, false things about you. Nevertheless, bad behavior is unacceptable anywhere. I have seen certainly innumerable situations in which a child would demand certain types of behaviors from an alienated parent in order to continue to come to visit. This is unacceptable. I have seen situations where kids actually demanded gifts every time that they appeared. And only on that basis would they continue to come visit and spend time. That's manipulation. It's unacceptable. Think of it this way. If this situation was outside of one of alienation, would you put up with, as the adult, would you put up with unacceptable antisocial behavior from an individual who was targeting you for retribution or otherwise? The answer is no, of course not. Don't put up with bad behavior. So as much as it might hurt, because there's a sense that if I don't give in, if I don't let him or her do this to me, then I might never see him or her again. And the only way that I can facilitate reconnection is if I allow myself to be hurt and manipulated. That's wrong. And it's also teaching the child a bad lesson, the lesson that they can manipulate others for their own purposes. So yes, it is extraordinarily difficult, but relationships, healthy relationships, should be defined by healthy behaviors by both parties. That type of behavior is never okay. Is never okay. Nobody deserves to be emotionally harmed for any reason, and not even if your goal is to reconnect. Unacceptable behavior is unacceptable. Now, what do you do, or what do you say? How do you convey to a child that you are warm and welcoming and look forward to and would like to facilitate your relationship with them? There are no true predictable words or actions that work in every case. And many of you, I'm sure, have heard of or have already practiced different things. So I'm just going to share with you some of the tactics that I share with my patients. First and foremost, always to explain and to express the fact that you love the child. It doesn't have to be effusive expression of how much I love you, but simply the fact, I love you. I miss you. I welcome you now, and I will welcome you at any time in the future. I am always here for you whenever you are ready. I care about you. And not only would I like to be a part of your life, but I would like you to be a part of my life. And I know that you're going to enjoy being a part of my life. These are simple messages, but they are honest, they are sincere, they're an expression of your affection and desire to have a relationship. And that truly is what the child wants to hear, that they are wanted, that they are wanted. Now, mind you, that messaging very well initially will stand in contrast to the false narrative that they have been taught, which is that you don't love them and you don't care about them. Of course, that is entirely misleading and untrue and harmful and hurtful to everybody else involved. And your messaging has to be one that contradicts that. It is most important that when you do this, when these messages are delivered to the child, adult or minor, that you are consistent with this messaging. It's simple, it's clear, does not require explanation, but stay consistent. The best way to prove to alienated child, again, minor or adult, that you don't represent harm, which is what they've been taught, that you don't represent neglect, that you don't represent the source of abuse, that you are safe, and that you are not the person that has been painted about you by the alienating parent, is to do so by remaining emotionally stable, not impulsive, to provide consistent messaging to the child, to be and remain mature in your responses, and persistent and consistent in how you present yourself. It is for this reason so much of an emphasis is placed on one's own mental health. When the opportunity finally arises where there's connection between an alienated child and a parent or grandparent, it is unfortunately has been the case in my own personal experience as a clinician that when a child has engaged in the first phase of blaming that person for what they did to the family, erroneously, of course, the targeted parent did not cause this, but should that blame then begin, then an untrained and unprepared alienated parent can react impulsively, defensively, and present a picture to the child that is not the picture that is in the child's best interest, nor the best picture intended for reunification. So instead, we want to remain cool and calm and take an approach of patience and gradually connecting with the child in, again, little baby steps to avoid negative behavior on your part, or behavior that the child can then say to him or herself, oh yeah, I knew that's what you were like because dad said that you were a dangerous and you always yelled. And here you are now, my first chance to come visit you, and you just yelled at me and you blame me. And we want to avoid that, and it is indeed avoidable. I want to share with you as we wind down here what I characterize as the 5 critical pillars for successful reunification. This is contained in an article that I am writing and actually have been drafting for far too long now. The term reunification therapy was coined, and in hindsight, I would argue perhaps many professionals feel that therapy is actually a misnomer. It's the wrong term. Dr. Warshak and many other clinicians who have established very successful, more formalized and structured reunification programs around the country speak about not therapy per se, but psychoeducation. Instead, I often refer to reunification as not reunification therapy, but as reunification engineering or relationship engineering, because it requires some of the same tactics and strategies as engineering requires. It is highly structured. It needs to be highly structured, very well planned, very well thought out, and set up and like an engineer would build a bridge, step by step, and ensuring there are no missteps. Lots of work up front. There's a vast difference between family therapy and reunification therapy. This is a question that was asked by one of you folks. I don't want to go into the nitty-gritty details between the two, but structured family therapy or more general family therapy and reunification therapy are 2 completely different animals. And this is the primary reason that most efforts towards reunification therapy fail. And it is because the approach that is taken is one that is akin to family therapy, which by and large doesn't work, as opposed to a relationship engineering approach. The people who intervene using family therapy to try to help families reconnect parents and children together, many of them are unaware or don't understand the critical elements that determine the ultimate success or failure of recreation therapy, and they fail to possess the very complex and advanced skills that are needed to effectively and strategically implement a therapeutic process. There are several factors that are associated with positive outcomes in established reunification programs that have been documented in the literature. We also know that the failure to integrate these key components reduces the chance of successful outcomes. Certainly, failure to integrate all of them is a recipe for disaster. For clinicians that provide conventional family therapy, and they start out missing some or all of these key ingredients, and if they know that the outcome is going to be less than 100% by not incorporating these ingredients, they may be operating simply on wishful thinking, that simply starting this process is going to be okay. As long as I get all the parties in the same room, I'll just do my old thing, and it always seems to work out. But this thinking is foolhardy and is potentially abusive to the child, because if there's knowledge in advance that you are not doing the things that you need to do in order to produce an effective outcome, and you do it anyway, and put the child in the middle of a very complex and demanding therapeutic situation, then it's a disservice to the child, and certainly a disservice as well to the alienated parent. So what are these 5 factors? Number 1, successful reunification therapy programs, reengineering programs, require the involvement of therapists that possess very unique skills. These should be clinicians that are forensically informed, as I mentioned before. The idea of having a clinician that is used to the idea of conducting the work with clients as an investigation, constantly gauging the accuracy of claims made by the different parties, of confronting people when they're not telling the truth, of also being impartial is a critical element. Impartiality comes from forensic training. It typically does not come from classical clinical training. And this way, this process will then avoid the potential bias from entering into the intervention process. There's number 2, specialized pre-treatment planning and organization. The clinician or team of clinicians and the clinicians sometimes are referred to as interventionists, are required to set protocols and explain those protocols in very clear detail, understandable detail, ensure that the parties understand what the protocols are, what the step-by-step procedures are. And therapy must be highly structured. The issue of confidentiality is a topic that needs to be addressed, because it's not necessarily the same level of confidentiality that would be present in conventional family therapy. The clinician can't be an advocate for one party or another. The clinician cannot take on the voice of the child, which happens so very often, that suddenly the clinician becomes the child's advocate in the reunification process, and that is the end, basically, of therapy, despite the fact it continues on. There have to be established communications systems for the court to inform the court about how things are going, where they're having issues, what other resources might be necessary, etc. And the expectations of all the parties need to be set, each of the parents and the child. One must implement a structured therapeutic framework that will effectively regulate the roles and the obligations of each of the people participating. Cooperation should be compelled by the court. If the child is put in a position, or the alienated parent is put in a position where they are not required to cooperate and collaborate by a third party, or where they are not 100% willing to demonstrate that cooperation and be held entirely accountable, this is also potentially a recipe for disaster. Psychoeducation is not psychotherapy. It requires that level of structure and adherence. And we set goals. We want to be breaking the alliance between the alienating parent and the child and facilitate a sustainable change, cognitively and behaviorally, in many different parties, in the alienating parent, in the target parent, in you folks, and in the child. So we have at least 3 parties involved, all of which come at this process from very different angles, very different views, very different feelings, very different stakes involved. It is extraordinarily complex, very challenging. Think of it as the guy on Ed Sullivan spinning all the plates around. If you have only 2 hands, but you're required to spin a dozen different plates, you've got to be really good at what you do, or have a team with you that are all spinning at the same time in the same direction. Number 4, strategic management of the dynamics and the communication between the parents and the child. I mentioned this before, so I won't belabor it right now, but it is necessary to invoke a power shift. It is often the case that the child who comes to reunification therapy feels that he or she has the balance of the power to direct and control the nature and process of the therapeutic intervention. That is not the case. It should not be the case. The child should never be in charge of the process. Only the clinician, only the interventionist. And therefore, it requires an interventionist that knows what he or she is doing. And then finally, integrating internal systems. What does that mean? Systems that will guide this intervention in the right direction. So the clinician wants to set very clear goals that are observable, that are measurable. Clear deadlines as well. What do we want to have accomplished and by when? And to be able to then report all of this information in a systematic and timely manner back to the court. What are the metrics that should be used? How do we measure if success is being drawn? Ultimately, we want to be able to establish new skills, newly defined relationships that are based upon new perspectives. So that all being said, what I'd like to do is what I'm going to call a lightning round. And this is going to be a lightning round of responses to those initial questions that I posed at the very beginning of this talk. And so here we go. I'm going to read the question again and quickly provide a response for you. In court-ordered therapy, where all were instructed to see different therapists, but they seem to be unfamiliar with parental alienation, deny its existence, and have done more harm than good. Well, this speaks to exactly what I just discussed a moment ago. The nature of the clinician is absolutely crucial. This is not an average run-of-the-mill family therapist or a trained clinician, but one that is highly immersed and prepared to conduct reunification therapy, or as I call it, relationship engineering. Will my alienated 15-year-old daughter have the courage to let me into her life when she's 18? Or will she shut me out for good? I don't know. I don't know. You don't know. Nobody knows. All we can do is control what we can control to be the best we can to facilitate a reunification and reconciliation. When an adult child cuts off all communication, how does a devastated parent even connect for reunification? Again, by some of the attempted outreach. Each case is different, of course. The attempted outreach, and in some cases, if the case still happens to be in litigation, there are mechanisms that might be pursued, including court-mandated reunification. Next question, how do you reprogram a 21-year-old to get them to reconsider what they've been taught to believe? Well, you can't reprogram the child whatsoever through your words necessarily, but again, through your actions. If they see you as a stable, safe individual that presents as a radically different person relative to the image that was conveyed to them during the alienation process, that is simply the beginning. Is it unrealistic to try to make inroads with an alienated child, or do I just give up? You never give up. Like the famous saying by Winston Churchill, never, never, never give up. How can a targeted parent ever hope for reunification? Hope comes from the destruction of hopelessness. And that could be done therapeutically or simply through other social support systems. But it is through hope and the elimination of some of the detrimental emotional challenges that a alienated parent feels that hope can be restored. If you are still feeling hope at this point in time, hang on to it and grow it, reinforce it. If you're feeling hopeless, then I would strongly suggest considering some form of intervention for yourself to suppress and eliminate the negative emotions that you're now experiencing and to reinstill hope that certainly you had at one point in time. I haven't spoken to my daughter in 3 years. Is the likelihood of reconciliation, does the likelihood of reconciliation get worse over time? And the answer is no. I certainly know of situations where parents and children have been reunited literally after 35 years. A case that I was recently working on. And other cases where alienation has not taken place for more than a couple of years. And at that point in time, the reconciliation was put into place. It is also the case that sometimes the efforts to facilitate reconciliation is as easy in a situation where there has been alienation for just a couple of years as there has been for 35 years. So again, the duration of the reconciliation does not necessarily correlate with how challenging it might be to facilitate a reconnection. How do I cope with my teenage daughter who behaves normal and authentic when with me, but completely different when she's with her dad? Well, this is a phenomenon, of course, of the child likely trying to protect herself, this daughter, that she feels, it could be the case that she feels very comfortable with you and wants to be with you, but under the guidance and oversight of an alienating parent, fears the potential consequences that might take place should she demonstrate any affection towards you. It's so sad when we see this, and we see this more often than not. I've seen many cases where, for example, kids are denied their allowances or denied vacations and other promises should they positively engage with the alienated, with their alienated parent. I'm a targeted mom with 2 adult alienated children who recently reconciled with me, but now they're threatening to cut me off unless I withdraw my motion in court. What's the best approach? Again, we spoke about this a little bit ago, that you are not and should never be put in a position to be manipulated or controlled by any other human being. It is, again, it is sad to say that, it hurts to say that, but if you believe that your actions as the adult require legal intervention and intervention with the court, that is the decision that you need to make. And then finally, and I'll reiterate this, is there any success with structured family therapy for one parent or child if they get the child to attend and with kind of a counselor? Again, seek clinicians who are forensically trained and informed, clinicians who are impartial, who approach these matters with impartiality and are exceptionally skilled and knowledgeable. Between their skills at helping to bring people together, facilitate communication, and their ability to demonstrate nothing but compassion with the goal of bringing together good people who have been wronged is the entire objective of our field. And on that note, I thank you very much. This is this concludes my remarks for today. I hope that you have had that you found my thoughts and some of this information to be helpful and provide guidance and support. And I look forward to seeing many of you at one of the next Family Access conferences. Have a great day and be well. Thank you.